Hello, good evening everyone. Since the final theory exams were over for the 2023 batch of RML Hospital, that is Guru Gobind Singh Indraprastha University of New Delhi, I thought of uploading the question paper. This might be helpful for the juniors for the next year exams and also those who are appearing for their respective theory exam in their university. So the first paper, the heading is of basic science. If we go through the question, the 10 questions, genetic basis of ESRD, expected one, aquaporins, nephron endowment, polyuria, management of metabolic alkalosis, again expected question, neuromodeling, repeated one, physiology of secondary hyperparathyroidism and calcium mimetic. See, there will be one question definitely from statistics. So that is what here you have seen. Different clinical study design and case control and observational studies with the example. So for a DM candidate, the basics of statistics you have to be clear with, and mostly you will get the question in the paper one. Next is various factors affecting GFR, advantage disadvantage of various methods. Renal Fanconi, another expected question. Pathogenesis of hepatorenal syndrome, coagulation abnormalities in nephrotic syndrome. Almost 70 to 80% were expected questions. Next, coming to paper 2. Paper 2, if we say, it is clinical nephrology, where question can be from any area. So in this here, if we see regarding the complement system, TMA management, ADPKD, another very important question both for theory and practical. Blood pressure and CKD with the recent guidelines and the major trials. You should not miss the sprint trial. And AKI diagnosis, indication, timing of dialysis. Probably you might have to discuss the trial, early versus late initiation of dialysis. CKD MBD, primary hyperoxaluria, a bit unexpected. Hopefully students might have managed this one. Alport syndrome, another important question. Symbiotics, prebiotics and probiotics in CKD. These kind of questions were more expected in paper 4, but if it asked in paper 2, you have to be ready. Role of plasmapheresis in vasculitis. You have to write down all the trials related to vasculitis, the famous Plexivas trial, everything have to be mentioned. Management of resistant hypertension, another expected question. Coming to paper 3, which is of dialysis and transplant. Mostly the question will be related to these two only. Dialysis adequacy and nutrition, very important question for practical also. Management of ABMR, AVF stenosis and thrombosis. How to preserve the residual renal function in CKD MHD patient, online hemodiafiltration, advantage and disadvantage. So some recent advances in the recent advances topic, probably it should come in the 4th paper, but they have asked here convinced trial. CAPD prescription, mTOR inhibitors, virtual cross match, PTLD management, intravenous iron and dialysis patient, you have to write about the trials. Diabetic kidney disease management, and you have to write few points regarding PD and HD. So that is why for paper 3 you might get this kind of some unexpected question like related to trials also. So the 4th paper, the recent advances. For a DM student, the 4th paper is always bit tricky, where they have to prepare for the recent advances which might not be covered in their textbook. So of 2023, the paper contains the clinical trials related to progression of diabetic nephropathy. This question anyhow very important. Most of the conferences always discuss these biomarkers of membranous proliferative glomerulonephritis. Management of IgA nephropathy, another important one. There is an excellent article, I forgot the journal name, but there is an excellent article where student might be aware for IgA nephropathy management. Various antigen in membranous nephropathy also have been discussed in most of the conferences. renal AA amyloidosis, and without lupus nephritis, the theory paper won't be complete. Either it will be in paper 3, paper 2, or somewhere there will be a question on lupus nephritis since the initial paper doesn't have. So they have brought it here, lupus nephritis, newer cross-mechanistically. Palliative care in ESRD, definitely there will be a question on trial. So here they asked about benefit trial, pruritus in CKD, and again ANCA vasculitis trial. Again another important question. So these were all the questions for the batch 2023. So the juniors can prepare for their upcoming exam.